Birth control pills. Millions of people rely on them daily, but have you ever wondered what happens when you take them for years? At first, it's all about preventing pregnancy, clearing up acne, or regulating periods. But as time passes, new questions arise. Can it affect my fertility? What about my hormones? Are there hidden risks doctors don't always mention? Today, we're uncovering the long-term effects of birth control pills, the truths you need to know, backed by science but rarely talked about in your doctor's office. Welcome back to HeInfo, your trusted source for health insights. If you've ever had concerns about taking birth control for years, stay with us. We're breaking it all down, no sugarcoating. Let's dive in. Birth control pills have revolutionized reproductive health, offering a convenient and highly effective way to prevent pregnancy. For many people, they provide not only peace of mind but also additional benefits like regulating periods, reducing acne, and managing menstrual symptoms. With just a small pill taken daily, contraception becomes simple and reliable. When used correctly, birth control pills are over 99% effective at preventing pregnancy. But not all birth control pills are the same. There are two main types you should know about. 1. Combination pills. These pills contain two hormones, estrogen and progestin. They work by stopping ovulation, thickening cervical mucus to block sperm, and thinning the uterine lining to prevent implantation. Pros. Highly effective at preventing pregnancy. Helps regulate menstrual cycles. Can reduce acne and PMS symptoms. May lower the risk of ovarian and endometrial cancer.
Cons.
Not suitable for people with certain health conditions, e.g., blood clot risks, high blood pressure. Can cause side effects like nausea, breast tenderness, or mood changes. Effectiveness may decrease if not taken consistently at the same time each day. 2. Mini pills, progestin-only pills. Unlike combination pills, mini pills contain only progestin and do not have estrogen. They mainly work by thickening cervical mucus and thinning the uterine lining, making it harder for sperm to reach the egg. Some mini pills also suppress ovulation, but not as consistently as combination pills.
Pros.
A good option for those who cannot take estrogen, e.g., breastfeeding mothers, people with blood clot risks. Less risk of certain estrogen-related side effects. May be safer for individuals with high blood pressure or migraines.
Cons.
Must be taken at the exact same time every day to be effective. May cause irregular bleeding or spotting. Slightly less effective at preventing pregnancy compared to combination pills. Which one is right for you? Choosing the right birth control pill depends on your body, health conditions, and lifestyle. While combination pills are widely used, mini pills can be a great alternative for those who need an estrogen-free option. Either way, talking to a healthcare provider can help determine the best fit for your needs. Now that we've covered the basics, let's dive deeper into what happens when you take birth control pills long-term, what's beneficial, what's concerning, and what doctors don't always tell you. Long-term use of birth control pills. Benefits, risks, and what you should know. For many people, birth control pills are more than just a way to prevent pregnancy. They can also help manage heavy periods, endometriosis, and menopause symptoms. Doctors approve these uses, so taking the pill for years is generally considered safe. However, it's still important to understand the possible long-term effects on your body. Let's take a closer look at the key factors to consider when using birth control pills for an extended period. Birth control and cancer. A double-edged sword? Hormonal birth control affects the body's natural hormone levels, which may influence cancer risks in both positive and negative ways. Potential increased risks. Some studies suggest that taking birth control pills may slightly increase the risk of breast and cervical cancer. The American Cancer Society reports that this increased risk for breast cancer disappears about 10 years after stopping the pill. Long-term use, more than 5 years, may raise the risk of cervical cancer, but this risk gradually decreases after stopping the pill. Potential cancer protection. Research has shown that long-term birth control use significantly lowers the risk of ovarian and endometrial cancer. A large study involving over 100,000 women found that those who had taken the pill had a lower chance of developing ovarian and endometrial cancer compared to those who had never used it. Some scientists believe this benefit comes from the fact that birth control pills reduce the number of ovulations a person has in their lifetime, leading to less hormonal fluctuation that might trigger these cancers. Birth control and blood clots. Should you be concerned? While birth control pills are safe for most people, they can slightly increase the risk of blood clots, which in turn raises the chances of a stroke or heart attack. A large study analyzing 26 different research papers confirmed that combination birth control pills, containing both estrogen and progesterone, can increase the likelihood of developing blood clots. The risk is higher for people who smoke or have pre-existing conditions that affect blood circulation. This is why doctors often recommend progestin-only pills, mini pills, or non-hormonal options for individuals with a history of blood clotting issues. Should you worry about long-term use? For most people, taking birth control for many years does not cause serious health problems. The pill is widely used, and its benefits often outweigh the risks, especially for those using it to manage medical conditions. However, it's always a good idea to check in with a doctor regularly to review your health status and any potential side effects. If you're concerned about long-term risks, a healthcare provider can help you explore alternative options such as lower-dose birth control pills, non-hormonal contraceptives like copper IUDs, lifestyle changes to manage hormonal fluctuations naturally. Ultimately, knowledge is power. The more you understand about how birth control affects your body, the better choices you can make for your health. Other long-term contraception options to consider. If you're looking for long-term birth control but want to explore alternatives to the pill, there are several highly effective options available. Each method has its own advantages and considerations, so the best choice depends on your body, lifestyle, and health needs. Keycap 1 Intrauterine Devices, IUDs. Set it and forget it. IUDs are small, T-shaped devices inserted into the uterus by a doctor. They can last for 3 to 12 years, depending on the type. Hormonal IUDs, e.g., Mirena, Kyleena, release progestin to prevent pregnancy and reduce heavy periods. Copper IUDs, e.g., Paragard, non-hormonal and can prevent pregnancy for up to 12 years by creating an environment that's toxic to sperm. Duration, 3 to 12 years. Pros, low maintenance, very effective, reversible. Cons, possible cramping after insertion, some irregular spotting initially. Keycap 2 Birth Control Implant, the tiny rod with big protection. The Nexplanon implant is a matchstick-sized rod inserted under the skin of your upper arm. It releases progestin to prevent pregnancy for up to 3 years. Duration, 3 years. Pros, extremely effective, no daily reminders needed. Cons, may cause irregular bleeding at first, requires a minor procedure for insertion and removal. Keycap 3 Birth Control Shot. Once every 3 months. The Depo-Provera injection is a progestin shot given every 3 months to prevent pregnancy. Duration, 3 months, repeat injections needed. Pros, convenient, may reduce heavy periods. Cons, must remember to get it on time, can temporarily delay fertility return after stopping. Keycap 4 Birth Control Patch and Vaginal Ring. Monthly convenience. Birth control patch, a small patch worn on the skin that releases estrogen and progestin. Replaced weekly. Vaginal ring, maneuvering a flexible ring inserted into the vagina for 3 weeks, releasing hormones before being removed for a week. Duration, 1 month. Replace regularly. Pros, easy to use, less frequent than daily pills. Cons, must remember to replace on schedule, not suitable for people sensitive to estrogen. Choosing a long-term birth control method is a personal decision, and what works for one person may not be ideal for another. Whether you prefer the simplicity of an IUD, the convenience of an implant, or the familiarity of birth control pills, the key is to stay informed and choose what's best for your body and lifestyle. Talk to your doctor about the best options for you. If you found this information helpful, like, share, and subscribe to HeInfo for more reliable health insights. Your health, your choice. Stay empowered. See you in the next video.